All right, we are now recording. Autumn, you want to walk through the agenda for me, or with what we have up first on the agenda?
Just Lori's updates.
All right. Go ahead, Miss Lori.
Oh, hello, everybody. It's been fairly quiet as far as, new, I haven't gotten any new positive cases. Other than that, I've just been busy with, I've been helping a lot with Sunset View. They're a pretty active campground, so they have, come to me on different occasions with, ideas that they had or things that they've done in the past just to see what they can still do, what they can't do, what they may be able to modify. So we've been kind of working a lot every week, just going through some of that stuff. I had a complaint in Ray's Trailer Park a few weeks ago, and they were very receptive. They did fix everything I asked them to fix, so that was really nice. I think I did get a phone call that somebody was interested in buying it, and they were looking into that, so I'm not sure what the status of that is, though. Had another issue with a person that owns a trailer as a rental property that's on their property as well, and the landlord had to put the tenant up for a few days in a hotel because they had issues with the septic, and so that was like a whole weekend fiasco as far as just trying to get things resolved and making sure the tenant knew what was going on, the landlord knew what was going on, and but there was that. We are still in phase 3, part 1 of the guidelines and the phases that the state is going through right now. And we've been in this phase for quite a bit, a few weeks anyway. And some of the changes, they did make a few minor changes to some things, but the big push right now, we're getting a lot of emails and information pushed out about mask wearing and the importance of mask wearing, and trying to keep the numbers down. And so that's, and I think the state is going to be pushing out some more PSAs and various things to say, hopefully not requiring or having the towns take on that task, because we're just pretty much maxed out as it is, just trying to get some of this other stuff done. And been working a lot with Tim as well with the Park and Rec, and kind of making sure that if he has questions on what some of the sports or the rental of some of his fields require, so we're trying to maintain a handle on that as best we can, and just continue with the weekly 2 meetings a week with the Department of Public Health, and answering a variety of questions that we all have. What's coming up next is a lot with the schools. I was supposed to be on the meeting this evening with the school department because they wanted to maybe ask me questions or run things by me, or just so that I'm informed of what their plans are, but that was canceled. So I'll be waiting for that to be rescheduled and take a part of that. One of the things I spoke with Audra about earlier in the week is the COVID money that we received through the state via the Hampden County Health Coalition, Coalition and the Pioneer Valley Planning Commission, and that money does need to be used by the end of the month. Speaking with my other towns, we were able to move some of the money that might have gotten paid or getting paid for salaries or for overtime to come out of that fund, and just other supplies that we think we might need looking ahead. I think this is going to be something that, we're going to be dealing with for quite some time, from just the way we're in this phase right now for as long as we have been. So, Audra and I spoke about maybe even some pediatric masks for children, and and any other things that the board might think would be necessary. Just thinking about what could have happened if we had to have a shelter. I know we've kind of talked this through our department head meetings on occasion, but maybe there are some supplies that we could get in in the event we had to put up a shelter during COVID, and how are we going to, if we have enough supplies and equipment to do what we need to do to keep a shelter safe. So maybe that's something we can also talk to Liz about, but we'd have to do that in the next few weeks and get that money spent. So I'm not sure what the, what we have left in it, or what it's been used for since, but maybe we can take a look at that at some point and take care of spending that down. And then just a few complaints here. I had a few
Sorry,
complaints
Lori,
Yep.
really quick, I'm sorry to interrupt you. I just wanted to let you know that I did talk to the fire chief too, and he is interested in getting a UV cleaner. I don't really know, so that he can, so he like puts it in the ambulance and it like sanitizes the ambulance after each call or something like that. I asked him to like look into it, so I don't know if we end up having funds left over that we want to
Perfect.
look at that. So he was going to get us some information on what he's looking for.
Good.
All right,
Good.
go ahead. Sorry.
Yeah, there was some other, I think I've heard some other towns getting that type of equipment as well, even for, you know, the town hall or for whatever else, other, you know, offices that might need to use something like that. But no, so all I was going to say is I did have, you know, when complaints have come in, I've just gone to the businesses, speaking with them personally, letting them know that I got the complaint, kind of going over, you know, some ideas of, you know, why somebody complained. And, you know, most of the time, I mean, all the time, they're very receptive. And, you know, there's times when a resident comes in and they see a snapshot of a moment, you know, when you look at it with the bigger picture, you know, sometimes it's a little bit more understandable, but everything seems to be going well in town, and hopefully we'll continue that and see where we go from here. That's about it for me.
Excellent. What do we have? So everything else is going good, you said, and I'm glad to hear that you're going to be in the school call, because I was concerned. Are they having graduation this weekend?
I haven't been informed about any of that. If they are, I don't know about it.
I believe they are, and unless it was postponed because of, I don't know, the power or whatever, but oh, maybe it's next weekend then. So I know that in the LEPC, last time we had talked to Cheryl Clark, I had said that I had wanted her to be in contact with you about that, and so you haven't heard anything from them on it?
No, I have not. No.
Ask a question. Hello. I had a question for Lori.
Go ahead.
Oh, yeah. Owen mentioned the funds Pioneer Valley Planning Commission to use. Did you say that it was use it or lose it by the end of this month?
That's correct. I'll find out more tomorrow. I have my meeting tomorrow with the Hampton County Coalition at 10 o'clock. So I will confirm that, but I did get an email that it stated something along those lines, but I just want to bring it to our attention. I think that probably is the fact, but if I hear different tomorrow, if they made any changes, I'll let you know.
Yeah, not to add to your email burden, but if you find out that maybe just a 3-worder out to us to say, yes, use lose it by the end of August. Here's my other thought on that. Is the MRC included in that, or are they on a separate leg that the Pioneer Valley Planning Commission funds?
Yeah, the funds that we got from the Pioneer Valley Planning Commission specifically was emergency COVID money that came about, you know, when all of this COVID. So it's not the normal money that we would get through the Pioneer Valley Planning Commission because we're the HCHC, but it's this is totally, you know, COVID money. And so, but the MRC, you know, thinking with the guidelines that they gave us to use the money, it would certainly fit in if we needed to do something, or if Liz might need something with, shelters or whatever for the COVID money. So,
Well, that's what caught me as I mentioned, a shelter. That's another whole, it just reminded me of all you hear on the news, and it's obvious that should there be a need for shelter use, it's very challenging because of the COVID restrictions and all. And I don't know, at some point we should, not right now, but we should address, like, oh my God, what do we do if there is a shelter need? Yeah, something that we could talk about with Liz. I'll make a note of that. We can all follow up on it later. Yeah, thank you.
yep. Okay, yep. Mary here. I'm all for, getting your list together of everything you want and checking it out, but I'm not in favor of spending money just for the sake of spending it. I don't want to have boxes of stuff, more than we need or we're not going to use that's going to go bad and get tossed anyway. So, yep, for sure. Thanks.
Yeah, I think we can. I don't think it'd be to exchange suggestions about things like that. We're always bouncing back to this open meeting law, consideration. But I think there should be a way each of us could be thinking about that and just exchange, not in depth, but just how about this or how about that, as the use of the money, and no vote, no further discussion, just mention it sort of like agenda item.
All right. That sounds good. So I think, we would have to call an emergency meeting to vote on any purchases we're going to make, because again, we're not going to meet until September. So the money would need to be spent by the end of August.
That's
Lori,
why I was thinking.
I'm sorry. What was
Yeah,
that?
I didn't mean vote decide. I meant just to express some just idea about it. Because obviously, if we're going to meet till September, there's no chance of deciding specifically. In which case, if there were some good ideas, we could meet briefly with a quorum to say, yes, let's use it for this or that.
Yeah, we can do that. Maybe we can look at like 2 weeks out and have a meeting to go over that, if there's any supplies that we've either MRC, shelter, LAPC, fire, police, or Board of Health specifically want to purchase, and we can vote on that.
And if no need, we could always cancel the meeting.
Yeah, exactly. Okay. That sounds good. And Autumn, what did we have next?
The next on the agenda is in regard to a flu clinic. I had a girl named Anna Fontaine. She is a pharmacy intern with Stop and Shop Pharmacy in Chicopee. And she was asking about possibly putting on a flu clinic. And so basically what it would be is, because it has to be based on insurance. So if there was one insurance, let's say for all town employees or any of I'm not sure if all the teachers in transportation and fire and who has what for insurance, but her goal was to be able to hold a flu clinic, knowing ahead of time what insurance the town had for the employees, and to put on a clinic. I believe if possible, she would like to put it on at some point in September, and it would basically be at no cost to the employees. It would go directly billed through their insurance.
So
I actually did make it to the call. I could tell that you guys are all on the phone, but I'm on the computer, so I don't know if you could see. I've been here. I didn't call in. I'm on my laptop. So hi, I'm Anna Fontaine. I'm
I'm sorry, I didn't know anybody else had their camera on. I shut mine off.
Oh, I turned mine on because I realized everyone was on the phone, and then you had turned yours off. So I am a pharmacy intern with Stop and Shop Pharmacy in Chicopee. I'm finishing up my last year of pharmacy school, And I have been reaching out to different companies on behalf of Stop and Shop Pharmacy in Chicopee, like Autumn said, to try and start up a flu clinic. So I had been talking with Autumn about it, potentially starting one. I know you guys have been talking a lot about COVID this meeting. So I don't know how much everybody wants to sit and listen about the flu. We do have a pandemic every single year, and that is the flu. So Stop and Shop, and we all find it very valuable and important to vaccinate the community against the flu, especially right now because of everything that's going on. So exactly what Autumn was saying, we come at no cost. We really just kind of need a space. We bring all the PPE that we need now because of COVID, masks, gloves, face shields, all of that. So we come all geared up. We bring the vaccine, which would be the quadrivalent flu-ad vaccine manufactured by GlaxoSmithKline, and quadrivalent means it covers the 4 strains. And we would vaccinate any and all employees that that would be interested in doing the flu clinic. We need a minimum of 25 people. I'm not really sure, what ideas you guys have in terms of where you would want to use us, but I figured I would reach out to you because I felt like it would be a good place to start to find a large group of people potentially under a similar insurance. So the way that the reason why you guys don't get billed is because the vaccine gets billed directly to the patient's insurance. We do not know as of right now how much it will cost your employees. What we would do is we would look up the insurance and run a test claim and see what the price would look like. Yesterday, I ran a test claim in the event if someone didn't have insurance, and the flu vaccine comes to $44. So hopefully, it doesn't come to that. Typically, most insurances cover the flu vaccine at little to no copay. So that was pretty much it. I just wanted to bounce it off of you guys and see if we could be of use to you in terms of maybe the fire department, teachers, your department. Like I said, any group of people with kind of a similar looking insurance plan.
So you're actually in luck, because I not only on the board, but I am HR and I do the benefits for the town. So
Oh, wow.
I will tell you, we are members of the GIC, so we offer 7 different insurance plans.
Okay.
So it could be, I would say the majority of people are on Health New England, but we do offer 2 Tufts products, 5 Unicare products, and some Fallon products. So, we have a wide variety. You would only be doing this for employees, right? Not open to the general public? Because the reason I ask, but it'll give you a little background, is we used to do them. The Board of Health used to do flu clinics, and the reason we stopped was because the Medicare billing became a nightmare.
Yes.
Also, getting rid of the sharps is a nightmare.
Yes, so that's kind of why we go after a more uniform group that has more similar insurance. As much as we love to vaccinate all of the public at once, we kind of set our goal at finding kind of like just a uniform group of people. Finding organizations that work together has worked best with I did a flu clinic with Stop and Shop in Enfield when I was on a rotation there, and that went really well. And so I know you said you have a couple different plans that you offer. So if you were to send that to me over email, I could run more test claims and look, or even get on the phone with every insurance company that 25 some of your employees may or may not have, and figure out, is it going to be covered, is it not going to be covered, what the copay would be.
Sorry, thank you. Okay, I can get that. Does Autumn have your email?
Yep.
Okay, so I'll talk to the powers that be. So I'll talk to our town administrator and HR director and see if that's something that we that the town is interested in sponsoring or having, and then if it is and we want to move forward with it, I will get your email from Autumn, and I'll send you a list of our plans, and we can go forward and do that.
Awesome.
I think that opening it up to anybody who's interested, town employees, would be great.
Yeah.
But the catch is going to be that we'd be offering it only to people on town insurance. So, it wouldn't help the employees who get coverage through a spouse or something like that. So,
Well, I mean, if we can get a broad idea of maybe what they have,
Yep.
it really isn't closed off. It's just a matter of, so like I said, we bring everything. We bring from the PPE to the vaccines to the laptops. So we will do the billing right there. So as long as, like what you're saying is, like when you were open to the whole public and everyone had different insurance and the Medicare
Yeah.
fee, we're just trying to get an idea of, before we go in, before we set up the whole clinic, do we know that the majority of everything is going to run through smoothly, so that we can just focus on getting as many people vaccinated as
Sorry. Sorry, we're having technical difficulties here. My phone is being eaten. Okay, I think that's good. So like people could drop in with like say somebody has a different insurance, and then
Yeah.
the only difference is you wouldn't be able to tell them ahead of time how much it would cost.
Exactly.
Okay.
Yeah, if there's just a small handful of people where the paperwork looks a little bit different,
Yep.
we take it back to the pharmacy, no big deal. We're just trying to get ahead of the game, so that when we're doing the vaccines right on the spot, we're not taking, an extra 15 minutes with one person just trying to work out their insurance. Oh, I can't hear you.
That's
I think
because
she
I just
muted
muted
herself.
myself right before I started talking. That I will look into it tomorrow, and I will send you an email.
Awesome. Thank you so
All
much.
right.
Yeah,
You're
I
welcome.
really appreciate being included in on the call. Thank you,
Thanks.
Autumn. And I hope it works
You're
out. And I
welcome.
do want to throw in our 2 pharmacists that would either be coming with me or doing the flu clinic themselves. They are from Monson. They're Monson locals, and they definitely wanted me to throw their names out there too and let you know that they're interested in getting the community vaccinated.
What are their names?
Maria Lewis and Callie Arbor.
Excellent. Okay. Awesome. I look forward to hopefully getting this rolling, and I will reach out to you tomorrow.
Awesome. Thanks so much.
Thank you.
Bye,
Third
guys.
question, I missed your name. Could I have pharmacy intern? I just wanted to write your name down.
Sure. My name's Anna, A-N-N-A, Fontaine, F as in Frank, O-N-T-A-I-N-E.
Thank you. I had one question, and we can get back to it later. Maybe Lori knows. Just now, thinking about flu clinic, I wonder if you're involved with, best resources for providing public information about the obvious concerns, I include myself, that people will have about with COVID concerns and then seasonal flu concerns. A lot of it just occurs to me, a lot of people might be thinking, should I get the flu shot? What's the official word on this? Maybe you could send Autumn the best resources for us so we can think about providing that information.
So the great thing about pharmacists, I'm going to toot our own horn here, is that we are very accessible healthcare providers. So we have people that come up to us and ask us all of that sort of thing, all of those sort of things all of the time. And we have the answers.
Exactly.
So typically you'll see online or posters like comparing the flu to the cold and how to tell the difference between those 2 viruses. And so I know you said a lot of people would probably be interested in COVID versus the flu and this and that. So unfortunately, we don't know enough about COVID to really put out for our pharmacy to give you a strong, this is what COVID is versus this is what the flu is. But we definitely have enough information on the typical influenza that we see every year and the cold virus. And we can do our best to answer questions about COVID, but with the limited information that we do have, and we can tell people how to best protect themselves, just like everything that's been put out by the CDC and the news currently.
Yeah, I was thinking about basic questions. I'll have the seasonal flu is not COVID. Yes, it's okay to get the seasonal flu shot, and it's still highly recommended for all the same reasons we always knew, and that sort of thing. Just real basic, but yeah, that's very good. Thank you very much.
You're welcome. All right, I'm gonna head out on the call. Have a good one,
Thank you,
guys.
Anna. Take care.
All right,
Yep,
bye.
thanks for having me. Bye.
All right. What else do we have, Autumn?
I have a comment on that,
Okay.
on the flu shot.
Yep.
I don't know how crazy I am about the idea of only offering it to the town employees. It seems like it might cause some animosity that we're putting ourselves before them if they're not able to get it.
Well, I think that we can look into having a public flu clinic. I think we can have more than one. I just think they're only offering it for town employees. And I'll tell you, a lot of communities do this, but the communities that do it mostly have like their own public health nurse that does it. But, you know, like Long Meadow does one for their employees every year. It's not, you know, it's not unheard of, but I think that we can certainly talk to Walgreens about hosting one, or somebody else about hosting one for the public.
And I would, if we were going to do it, I would say do it at the same time or before.
You have to at some point, you know, prioritize your employees as well. I don't think that, you know.
Nobody's there.
Well, that doesn't mean they're not subject to the flu.
Well, I know, but
they're just not going to get it
out in the public. We have people, those of us who are out working, you know, all day, every day at 8 different jobs that are still out with people. Our teachers and the people working in the town offices aren't even there. So to me, I don't think it's going to look right. And if we're going to do one, you know, set one up for the public, I would just recommend we did it at the same time.
I think we've done this in the past where we've had flu clinics for the public, and we've worked with Lori from the senior center, and we've had, when it was Rite Aid or whoever, and various times throughout the years have provided that. And I think when you're working with a couple different entities, I think the important thing is, as long as we are forthcoming and we put some advertisement out that this is what's going to be done and when it's going to be done, and that people know that they're going to have an opportunity at some point to get the flu. I don't think we'd have to be as concerned about the timing of it, but just that it's going to be available, and this is how we're going to do it, and we're thinking about everybody, but because of certain things, we have to do them separately. And I think the public at large would probably be, you know, happy with that. Because there's a lot of drugstores that are constantly giving out the flu shot for free too, as well. So we can, you know, also get some information out about where anybody can go to get the flu shot in, you know, various places. So
there's high emotion in town now, and I just didn't want to add anything else to it.
Yeah.
I was thinking back to the last flu clinics I was involved in. It was at the senior center. I think that's what Laurie remembers also. It seems to me, I remember one day that we did, I can remember because I was given flu shots, but it seems I remember that we did have all the town employees come sort of at a certain time. Because I remember it was one town employee after another, fire department, EMT, et cetera. But I can't remember if it was to the public was the same day or if it was just like 2 days in a row or something. But what happened with our Board of Health doing the flu clinic, and I don't know if Mary is aware of the details, the logistics of this, is with the increase, which is a good idea, but with the increased requirements that came about from the state for the data we had to collect, report, through the portal and all about every single person who got a flu shot. There was quite a tedious procedure, and it got way over our heads. We just could not. We need a sponsor. We need something like this, like Anna Fontaine was just telling us about. It's beyond our capability to do this alone.
Yeah, I would just feel better if we were setting up something for the seniors before we did anybody else or people with the compromised system.
Yeah, I agree, and I think we should look at that just to see how we can address that.
Do one of you want to go to Walgreens and see if they want to host a community flu clinic?
Not me.
Oh, yeah, I just, I'm not up to date on the details. Maybe I'd be willing to go talk to them about it. What do you say did you say Walgreens or is that what our local pharmacy is now?
Yeah, that's
Yeah.
what it is down. But
Yeah,
let
it's a
me,
Walgreens now, okay. They've
Let-
been through a few
I'll let you know,
changes.
Bo. Let me talk to Evan and let me talk to Anna tomorrow. If they're willing to open it up to the community, then we don't have to find another group to
Yeah.
go with. So let me see what
Let's
she
check that
says.
out.
Okay, and I'll let you
No
know.
one may even participate, Audra. Nobody may even go. But it's
What do you
just
mean?
the
Oh, yeah.
you know, but it's
I know what I hear what you're saying. I hear what you're saying, Mary. I know where you're coming from. I see the same complaints. I see the same uneducated opinions. I know where you're coming from. I don't want to add fuel to that ridiculous fire either. However, I do know, like in talking to our pediatrician, who the pediatrician we go to used to be the head of immunology for the state of New York, and I know in her, we were talking about just how awful this winter is going to be, and and I said, well, what's our protocol as parents? Like, how do we know what's sick and what's sick? Like, how do we know the difference? And and she said basically all the medical professionals are doing is trying to vaccinate against the flu as much as possible. So I think any opportunity that we get to push this out and offer it, I think is a great use of our resources or time.
in a perfect world, and I'm with you 100%. Everybody should get it, go for it. I'm just worried about the drama that'll be connected to it, and if we can find a way around it, it would probably be best for everybody.
Okay. I'll see if we can get Anna, if she's willing to open it up to the community, then I think that would be great. Even if, like Bo said, we do a 2-day event or something.
Yeah.
So, all right. I will.
Yeah, thanks, Audra, for following up with
tomorrow.
it.
Yep. Do we have anything else on the agenda, Autumn?
We do. We have.
My baby's losing it, and my dad's driving them around on a lawnmower.
Well, we have minutes to review, and we also have the plastic bag ban.
Ooh. Did
I believe that you had said to put that on the agenda.
Did I?
At probably one of the last meetings.
Oh.
Well, in the meantime, the state says I think it's local or business initiative, just like at Adams now. You can bring your own bags, but they won't handle them. And so as far as the state's concerned, we've made a little step forward there already.
Yeah.
I'm not sure what else we could or should do right away.
I think that we should, let's just table the plastic bags. I think the state needs to catch up with it and go from there. I'd love to get back to where we were with it and make more progress on it, but it's with everything right now. We start working on that and the state steps back from it, and then it's just a bunch of wasted time. So I think we table that. And then the minutes, how are we on the minutes? Are we still working on those, or Mary, how are you feeling about the minutes?
Yeah, I'm still working on the 20th, and then that's the 20th of May. And then at the last meeting, I just wanted at the end, it said that we have a couple of new positive COVID cases reported in town. I think if we can put the number of how many cases were reported instead of the word couple, instead of assuming it's 2, but.
Is that the July 10th you're referring to?
Was that our last meeting?
Yeah, that would be July 10th.
Yeah.
I think, and Lori can probably give you that number. I thought it was 3, but.
All right.
Lori, do you remember?
Say that, I don't remember.
Let's
The
see, in
last
the,
count.
case,
Well, I figured if we were gonna put something like that in there, we should probably put the number that we're talking, what we're
oh,
referring
a couple
to.
new positive COVID cases. Yeah, I see. It's non-specific, like a couple of new cases.
I think the last count of new cases we got, Lori, was the 3 cases in the household
think
that had
so.
already been counted.
Right. Yep.
So I would say that
That's-
number that is referenced there is probably 3. I'm comfortable
3
saying
new
that
cases?
number was 3. Yeah.
And then
Okay,
after
what-
that, it says, oh, sorry.
No, you go ahead. Sorry.
After that, it says it's important that people continue to wear their mask. I don't think we weren't quoting it. If she was quoting somebody there, Audra, or Autumn, I didn't know if you were quoting somebody. If you were, I would put that it was a quote, or otherwise I would just put that it's recommended that people continue to wear their mask. Let's see here.
Okay.
So,
That's all.
okay.
Yeah,
so let's see here.
if it was a direct quote.
Okay, so it's recommended that people, okay, yeah, I'll just change that word. Yep,
Thank you.
you're
All
welcome.
right. Make a motion to approve the July 10th minutes as what's the word I'm looking for? What is the motion?
Amended.
As amended. Thank you. As amended. Anybody want to second the motion?
I'll
I'll
second.
second. Yeah.
All right. All in favor, Mary, your vote.
Aye.
Bo, your vote.
Aye.
And I vote in favor as well. All right. And we will continue to table the May 20th minutes and continue to work on those.
Thank you.
There was 2 other ones. There was
Two
June
other ones?
10th and June 17th.
I make a motion to approve June 10th and June 17th meeting minutes.
As
Aye,
presented?
second.
Okay. All in favor? I'm Mary,
Aye.
Bo,
Aye.
and I am in favor. So all of those 2 are approved as well.
Perfect.
All right. Does anybody have
Do you-
anything else?
Did you want me to schedule a meeting for 2 weeks from now for
Yeah,
PVPC
let's
money,
do
or should we
that.
wait?
Let's do 2 weeks from now and get it scheduled and get it on the calendar. And if we don't have anything and we end up canceling it, we cancel it. But let's schedule it and see.
Can
Sounds
we
good.
do live and in person for anybody who wants to be live and in person?
I'm sorry, what was the question?
Can we meet live for any of us who want?
Oh, yeah, we were you're thinking about that. Yeah. What's the thoughts on that now? Is anyone meeting any of the other boards or anyone?
The
what
Board
are
of
the Board of
Selectmen
Select people
the
doing?
Board of Selectmen are really the only ones meeting in person.
If it's good
Well, if
enough
we're
for
doing it,
them,
we
it's
can
good
do
enough
it.
for us.
I'm not really interested in being in a closed space at the moment with other people, but
You
Meet
wouldn't have
outdoors.
to be.
what's that, Mary?
You
Meet
wouldn't have
outdoors,
to
I
be.
said.
Those who want to go could go, and those who don't can continue the Zoom from home.
I think we have
that
to
means,
work out an agreeable plan. Well, go ahead.
yeah, the only thing I have to look is I know, so if as chair, remoting in changes, you can't chair a meeting remotely. I don't know if COVID changed that with all the other open meeting regulations that changed, so I'd have to look into that, but I can look into that, and we can just post the meeting as is, and then if we make a change this week, then we can make a change to it. How does that sound?
Okey doke.
Okay. And anything else?
Yeah. I had a question
I'm set.
for Autumn. How's Bulky Day going? I mean, Bulky
It's been
Day.
going-
Bulky Pickup.
Yeah, pickup. Yeah, it's been going great. I believe
Oh,
we're
good.
on our 3rd week, and They've been fairly full, not 100% full, depending on how many requests we have per day based on the addresses. But yeah, it's going well. Getting done.
And for Laurie, I would say, how's the tick-borne illness, EEE, and other such, particularly anaplasmosis that you mentioned?
Yep, it's been, I spoke with Angela, probably the middle of last week, and she still has, there's still not the EEE, but that other one for tick diseases are still kind of coming in for Monson. The state has, put out more information about the EEE, that we've got to be very diligent. I think they had their first case out in Eastern Mass just the other day. So they are like, this is kind of early. We had last year was our worst season in a long time. So we're just kind of keeping they're getting their testing done and letting us know, as time goes on. So we'll see what happens when the mosquito season gets a little bit more ramped up. And but they're putting out a lot. I sat in a meeting maybe, I don't know, a month ago, just with more information about EEE and this year, and protocol, and what to kind of get ready to do. So we'll just I'll keep everybody posted if I hear any more, and just being able to let our residents know to be careful when it comes to dusk and dawn and mosquitoes.
Well, and the ticks too, I didn't know if there'd been any reporting of any other cases with the HGA and the tick borne.
Right. Yeah, not so much with Lyme at the moment, but the other one, I guess she was saying that.
I know. I had to go back to school myself, even though the ehrlichiosis was the one I believe you let us know we had a case or two. And okay.
Yep. So, I'll keep you posted.
Thank you. I'm all set.
All right. Anything else, Mary? You said you were all set?
I'm all set.
Okay. Motion to adjourn?
I'll second that motion.
All right. Have a good night, everybody. See you in 2 weeks.
Bye-bye.
All right. Thank you,
Bye.
everybody.
Bye.